welcome everyone. I am Theodora Scarrato with Environmental Health Trust, Executive Director, and I'm here with Dr. Anthony Miller, Advisors, who's currently Professor Emeritus at the Dalai Lama School of Public Health, University of Toronto. He has quite a career, which I am going to be asking him about. He served as Director of Epidemiology at the National Cancer Institute of Canada, Chair of the Department of Preventive Medicine and Biostatistics at the University of Toronto. He also was an advisor to the World Health Organization International Agency for the Research on Cancer and reviewed literature that's in the monograph on radiofrequency radiation and cancer. And he also was a consultant to the Division of Cancer Prevention at the U.S. National Cancer Institute. So thank you, Dr. Miller, for joining us today.
Pleasure.
Great. So we are excited to be starting this series. And what I wanted to do is ask you a few questions about your work, your research, and your publications. And then we'll answer questions to participants on this webinar as well.
Good.
So you have published over 600 peer-reviewed articles on environmental health. And most recently, 3 I wanted to point out are on radiofrequency and cancer. Can you tell me a little bit about those publications and the conclusions of your research?
Well, what we did was to review the literature published up to the time we completed the papers on radiofrequency radiation and its effect on humans and its effect on animals. And one of the things that was extremely important in this regard was that last year, the US National Toxicology Program released the results of a very prolonged study of the effects of radiofrequency radiation on laboratory animals, rats and mice, and they found increased risk of the types of cancers that the human epidemiology studies had found, which really corroborated the information that had been collected from the human epidemiology studies, which were conducted in Sweden, an international study called Interphone in a number of countries, including Canada, which was recently reanalyzed, the Canadian component, to confirm increased risk from exposure, prolonged exposure to mobile phones. And also, we looked at the reported mechanisms, the biological studies, which had looked at the effects of radiofrequency radiation on the metabolism of cells and the growth of cells. And what we found was that everything brought together showed that radiofrequency radiation was a human as well as an animal carcinogen. Now, the fact that we had confirmatory animal evidence was extremely important because years ago we decided if new chemicals were to be released into the environment, occupational environment or the general environment, they should be first tested in animals to show that they did not cause cancer in animals. We know that all agents which cause cancers in humans, when adequately tested, cause cancers in animals. So there is this parallel, this biological effect, which we need to bear in mind. The fact is that people have, the various telecommunications organizations have introduced radiofrequency radiation for communication, cell phones, and indeed other things now. They're talking about driverless cars, interaction with machines in your home, as well as in the occupational environment, which will increase humans' exposure to radiofrequency radiation and almost certainly increase the risk of cancer. In fact, it's not only the risk of cancer we're concerned about. There is good evidence that radiofrequency radiation will affect children, will cause the children to have learning disabilities. This may well carry on into life, into later life. We are all very concerned when we know things affect children, because all cancer-causing agents, if the exposure begins early in life, will result in increased risk of cancer later in life. Now, the cancers that we have predominantly seen as a result of radiofrequency radiation exposure are cancers of the brain, glioma, glioblastoma, malignant tumors. And the reason this occurred is because they have occurred in people who held their phones to their head and had prolonged use. And studies in Sweden, one of the first countries to introduce these sorts of phones, have shown that prolonged exposure, 10 years or more, substantially increases 2 to 3 times, if greater than 10 years or more, 4 times the risk of brain cancer. Now, it's true that brain cancers are not a very common cancer, but it's not the sort of cancer that people want to have. The other types of cancers seen in animals and humans are cancers of the nerve, which goes from the ear to the brain, what we call the vestibular nerve. We have vestibular neuromas with types of cells which are called Schwann cells. And it's important to note that these cells have been shown to be present, Schwann cells increased in the animal studies. The other things the animal studies have shown, and there's been a recent new paper from the US National Toxicology Program confirming this, is increased DNA change in the DNA. And we know that change in the DNA precedes the occurrence of cancer. So radiofrequency radiation is now almost ubiquitous. And we are very concerned that there will be major problems in the future. And they've already begun. I mean, we've already seen increase in the incidence of brain cancers in young people in the United States, and also in the UK, particularly of glioblastomas in the areas of the brain closest to where people hold their cell phones, what we call the temporal lobe on the side, and the frontal lobe, the front. And that is very worrying, because when we're seeing these relatively early changes in the incidence of cancer, we know this is just the beginning of a major problem in the future.
Thank you. And with smoking, how long did it take before we went from seeing effects, reported effects, to actual policy changes around smoking?
It took a very long time. In fact, some of the first studies which reported the effects of smoking in causing lung cancer were published in Germany just before the Second World War. But it was not until the large study of British doctors reported in the United Kingdom by Sir Richard Doll and his colleagues, and the study in the United States, corresponding study, which was reviewed by the Surgeon General, and the Surgeon General reported on this, that we saw that people gradually accepted that smoking increased the risk of lung cancer, and indeed of other cancers. And we did some of these studies early on in my research career in Canada, showing increased risk of a number of cancers from smoking, lung cancer in women particularly from heavy smoking. Up till then, people had thought that women might be immune, bladder cancer, and other cancers increased by the. So it took nearly 40 years before people recognized there was a problem and started to take action. And interestingly, the most effective action at that time was taxation, increasing the cost of cigarettes, which essentially made people cut down, and many of them stop smoking.
Right, 50 years. Well, I want to ask you a few questions related to what you just spoke about in terms of children. What do we know about children's vulnerability in terms of their exposure and in terms of effects? Like how are they more vulnerable?
Well, we know that children can be exposed for a number of ways to radiofrequency radiation. We're particularly worried about children who may be introduced early to the use of cell phones as a playing with them or using them. We're worried about the devices put by the beds of children to warn parents if they are children that are waking up. In fact, I don't know why they need that. My wife and I had 5 children, and it was not easy to know they were waking up and needed attention. The other thing is that children are very vulnerable in various respects. They have growing organs, their skulls are much thinner, and in older adults, a cell phone held to the side of a child irradiates more of the brain than it does an adult, so they get a higher dosage. And of course, children are going to grow into adults. And if you expose children in their early years to radiofrequency radiation and they continue with the exposure, the effect is going to be very substantial in increasing the risk of cancer and other conditions later on in life.
How about oxidative stress? I know that recent publications that have reviewed the impact of electromagnetic radiation, non-ionizing, and oxidative stress, the majority of them have found an effect, an association. Can you talk about oxidative stress and its relation to other diseases?
Well, this is not something that I have personally researched. I'm not a biologist, I'm a cancer epidemiologist, but we know that oxidative stress is caused by exposure to cell phones. And I know people who've studied this who are extremely concerned. They feel this could lead to not only cancer, but dementia and other conditions later in life, maybe increase in Alzheimer's, as well as loss of reproductive capability, radiofrequency radiation, sources of radiofrequency radiation, cell phones, for example, near the genitalia of men it's now recognized cause infertility, and there's concern it may well cause infertility in women if they keep them cell phones near their ovaries. We also know that there's reason for concern over where women keep their cell phones. There have been advertising to promote keeping cell phones in women's bras. Well, that we now know is likely to increase the incidence of breast cancer. And there have been several reports of women who've kept their cell phones in their bras where increased risk of breast cancer has been demonstrated, with the cancers being multifocal, as we call it, in a number of different places in the breast, and mirroring the antennae of the cell phone where it was placed. So all sorts of reasons, we know we have to be extremely concerned about radiofrequency radiation. And
the cancers, these cancers that were found in young women who put the phone in their bra, that they were multifocal, as I understand it, is important because it was an unusual type of cancer in a place that you don't typically see breast cancer?
That's absolutely true. You don't normally see cancers in this place. The women tended to hold the cell phone in a way that was outside their breast, and the cancers that occurred, as I said, mirrored the antennae in the cell phone, and they were multifocal. That means a number of different sources, different sites of cancer, approximately in the same area, and they could be seen on mammograms. These women did not have any of the major causes of breast cancer in early life. They didn't have positive family history. There was no change in their genes that would lead them to develop breast cancer early in life. And we think there's little doubt that these relatively rare causes of cancer, but nevertheless concerning, were caused by the radiofrequency radiation from the cell phones kept in their bras.
Mm-hmm. And all phones actually have instructions in the manual or the operating setting that says that they should not be at body contact. And
exactly. The manuals, which are often in small print or hidden in the phone, definitely show that. Phones are tested to indicate the degree of radiation, but it's always a distance from the body. So if humans ignore that, put phones close to in their bra, keep them in their pockets, then they have much stronger exposure, because the further away you are from a source of radiofrequency radiation, cell phone, cell tower, the less your exposure. We say distance is your friend. Keep the devices away from you as far as possible. If you have to use a cell phone, text as far as possible. And when you're using them, keep them as far away from you as you can.
I see, I have teenagers and kids, they text, they stream videos and music with it resting on their body or against their chest. Sometimes they use headphones, but then they have the actual device on their abdomen. And that's how people use devices these days.
Yes, well, you're absolutely right. The closest these devices are, the worse, the greater the risk. So we must try and teach children. In fact, there's no particular reason one should give children cell phones, except to keep them occupied, which is what parents would like to do. But in fact, we never had any particular problem keeping our children occupied in early life. At least my wife didn't. She did most of that without cell phones.
And you have 5 children.
I have 5 children. In fact, I have 5 children, 13 grandchildren, 3 great-grandchildren.
So what do you recommend to parents of children today in terms who hear about this issue? Many are working hard for policy change, and some get scared. I mean, this is really, it's a lot to take in when you first hear it.
I agree, it's difficult, but we coped with, at least my wife coped, with bringing up children without cell phones. We know it's possible. No particular reason why that shouldn't happen again. All we're doing is warning parents that they should find other ways in which their children are entertained and kept busy reading. And children learn to read fairly early in life and can get a great deal of benefit from reading. And that is done on books which don't emit radiofrequency radiation.
Right. And I know that over 20 countries actually recommend either their public health authorities in various, or the government websites actually do recommend that children reduce exposure to cell phone radiation. Yet most people are unaware of the recommendations by their own governments. I know in the United States, this has not been stated in a way that tells parents, really, you should reduce exposure. Although the Department of Health of California, as well as Connecticut, both say that parents should work on reducing exposure to their children from cell phone radiation.
I agree. Well, the general feeling seems to have been, oh, there's no problem here, but they're wrong. And this is why we increasingly are trying to work with people in localities and get the message out that we're dealing with something that is even now hazardous and can be even more hazardous if exposure continues and gets greater. I mean, the idea that you're putting up satellites to bombard the Earth with radio frequency radiation from satellites, it's criminal, and governments need to do something about it.
And now with 5G, there's going to be millions of new antenna sites around the globe. Their industry is proposing and installing small cells, so-called small cells, which are really short cell towers, to be within, like in our community, there's a proposal now to be able to put them up 30 feet from homes. And in some areas, they really are every few homes where they are being proposed. I know that you just were a part of a press conference on that in Canada, and that several medical organizations, the Cyprus Pan-Cyprian Medical Organization, a group of doctors from Belgium, as well as the EMF scientists and the 5G appeal, are all calling for a moratorium on 5G. And I wonder if you could talk about 5G and the Internet of Things and your opposition to that, and why this is so important of an issue.
Well, I am opposed to the introduction of 5G. I'm opposed because of the frequency of the antennae, the way that no one is going to be able to escape from being exposed. We already know this sort of radiation is damaging to plants, insects, and probably animals. And I think we're going to see some major changes in our environment, which will wake people up, but a bit late. We have to try and do something about it. I have personally been to 3 different communities. I have to go to another one next week, in which we're trying to persuade the municipalities that it's their role to prevent this happening. As I understand it, in the United States, the government is trying to prevent people discussing the ill health effects of radio frequency radiation. I think that that's absolutely criminal, and that Environmental Health Trust and in Canada, Canadians for Safe Technology need to promote widely the fact that we're dealing with a dangerous agent. The Internet of Things is not going to be beneficial. I don't know what you feel, but the idea of a driverless car does not encourage me in any way. And I think that we have to look very carefully at the alternatives. And the alternatives are with us. The alternatives are there. We use wired, particularly optical fiber, which is much faster and much more convenient and can give internet connectivity much easier. And there are all sorts of ways we can use wires to deliver this rather than being wireless.
Yes, thank you. There are solutions that we can use to substantially decrease instead of increase.
We have solutions available. And there are all sorts of people who know about this, and we should listen to them.
Mm-hmm. Yeah, and you were mentioning something. In the United States, the Telecom Act was passed, which says that as long as the radiation levels are within FCC limits, compliant with the FCC, that environmental issues can't be, used to in the citing and decisions about the citing, and then that's been interpreted in some court circuits to mean health effects, but not all. But what's happening in actually Baltimore, which is really near me, people were speaking about the health effects because people can speak about this, but they were actually stopped in this particular hearing from speaking about their opposition based on health. And city officials will say, oh, my hands are tied. It's up to the feds. I can't do anything. I can't think about health. And people are shocked to learn that this situation even exists. It's unconstitutional.
I agree it's unconstitutional. It's against your constitution, it's against ours. But somehow governments seem to feel they can ride roughshod over people in terms of health issues. We need to have increasing concerns being voiced. Members of Congress need to be educated. Senators need to do something about it. The FCC's regulations are old. They don't represent more recent research. One thing we point out to people is that those who promote this are actually putting themselves at substantial legal risk. They cannot get insurance against the ill effects of radiofrequency radiation. The insurance companies have decided they cannot insure people against this. So what's happening is that a number of people are exposing themselves to legal liability and not recognizing it. And they'll wake up in 3, 4, 5 years and suddenly find themselves in terrible trouble.
Mm-hmm. I know that Swiss Re just rated 5G as high risk, an emerging risk with a long latency.
Right.
And like you said, in the United States, even the telephone companies can't get insurance.
No, they cannot. And they cannot in Canada either.
Right. Well, there's actually a clip, and this is there's a clip of you testifying to the city of Toronto about cell towers way back, several years ago. It's online. Now, are there in your area small cells being proposed in community?
I don't know of any in my particular area. As it happens, my television, telephone, internet is provided by Bell Canada through fiber optic cable to my home. So I'm hoping they will be sensible and leave that and not introduce any of these little towers, communication things related to 5G, because we're already getting fast internet from fiber optic cable, which is far preferable.
You're actually pointing to something so important, because we'll often hear, oh, we need it to get faster internet, but actually all of us have systems in our homes for, well, not everyone actually, but many communities, they have access to fiber optic, and they have systems in their homes that provide what they need right now.
Yep. Yes, I went to a city a little east of us a couple of weeks ago, and it turns out that there's fiber optic distributed throughout the city, and yet the municipality, at least the city governments, are talking about introducing 5G. They don't. It'll be far less costly for them to actually build on what they've already got, which is potentially fast connectivity through fiber optic cables.
Mm-hmm. You brought something up about cost, and I think that money sometimes ends up being how things get moved. Like you talked about smoking and how the taxing of cigarettes had an impact. And you look at lead, what is the cost of lead to a community? And you can think about that, like, what's the cost to remediate, or what is the cost in terms of children's health impacts?
Yeah. Well, I think you mentioned lead. I mean, this was fairly rapid, at least not rapidly enough, recognized in Flint, Michigan. But I mean, it's now people understand a great deal more about that because of the publicity. And one of the interesting things is that people have quickly determined that there is a cost associated with vaping, which many people felt might replace smoking. But in fact, it turns out there's dangers associated with that. So they're doing something about it. Governments have an obligation to protect the health of people. And France, Germany already, Switzerland already taking action. We need to take action in North America to catch up to our European colleagues.
What kind of actions do you think are recommended in terms of electromagnetic fields and radio frequency?
Well, we need more publicity to explain people how to use cell phones more safely. You should use the hands-free devices as far as possible and keep this. We need to publicize keeping the cell phones away from the body. And I think governments have an obligation they're not fulfilling, and we need to persuade them. We, the people, need to tell the governments they have to do something about it.
And I know that you're one of hundreds of scientists who are echoing the same statements and recommendations. Why has there been no action in North America at this time?
I think the economic benefits to governments from having these big organizations which use radio frequency radiation is such that governments don't want to do it. But I personally, I've said it today and I keep on saying it, that that shouldn't overrule government's obligations to people's health. We have to do something about it. We have to get our governments to change. It's interesting that we, some years ago, managed to work through the Canadian House of Commons Health Effects Committee, and we had passed that Health Effects Committee passed a number of good recommendations for reducing radio frequency radiation exposure to people. But there was an election and the new government completely ignored it. And in fact, I have been trying to work through our MP and she ignored it. Well, she was voted out recently. We have a new government, we've got to do, it's a minority government, but we have to do something about it. They have an obligation to the health of Canadians, as has the Congress of the United States an obligation to the health of United States citizens. And we all have to interact with them, make them do something.
Mm-hmm. I know in the United States, everyone points the finger at someone else. Everyone says, well, FCC says I'm not a health and safety agency. I defer to the health and safety agencies. Yet we have no health and safety agency addressing with authority over the antennas. And the FDA is rejecting the findings of the National Toxicology Program. How is this study being dismissed when it's a $30 million study that was recommended by the FDA and the most carefully controlled study of its nature ever done in the world with those intensities and with such careful exposures to so many animals? What do you think about the downplaying of these findings?
Well, I find it difficult to understand how people can behave in this way. It's the sort of statements being made such that, well, the dose is much higher than used in humans. Well, this is what you do in animal carcinogenicity studies. you cannot expose millions of animals to the agent. You have to reduce the numbers. But in fact, it's not just the National Toxicology Program that's shown danger to the effect of radiofrequency radiation increasing cancer in animals. There's also a large study done in Italy by the Ramazzini Institute, which used much lower dosages of radiofrequency radiation and still showed the same effect. So we have very good evidence that radiofrequency radiation is an animal carcinogen, and we've had good evidence from human studies in Sweden, Canada, other countries, that radiofrequency radiation increases the risk of brain cancer. And we have to do something about it. We're on the cusp of a major human tragedy, and those who refuse to act are, well, they may have left their position or something, but they must be held accountable.
There's, there's also research showing a synergistic effect. I know that Dr. Fiorella Balpoghi of the Ramazzini Institute, when she presents those findings that you talked about, she also has spoken about, they're also doing research exposing animals to radio frequency and a known carcinogen. And then there was the Lurchel study that was a replication. And I wonder if you could talk about the combined effect from combinations of electromagnetic radiation plus.
Well, this is extremely worrying that we're now getting these findings, or we're reminding ourselves about these findings that radiofrequency radiation, together with other carcinogens, dramatically increases the effect of the carcinogens. Mm-hmm. It potentiates them. Yes. We are exposed to a lot of things we shouldn't be. And almost certainly in our environment, there are other agents which can increase the risk of cancer. As soon as we recognize that we're dealing with one, we need to do something about it. So we need to reduce our exposure. There's no way we'll knowingly expose people to a lot of lead, a lot of benzene, a lot of asbestos. We've learned how to deal with them, and we're still trying to do it, but we are reducing people's risk, and we have to do this with radiofrequency radiation.
Mm-hmm. Thank you so much for your work on this. I had a question. What got you interested in this issue?
What got me interested? Well, the reason is that I began to learn about the effects many years ago, more than 20 years ago. And in fact, I was asked to study the effects of electric and magnetic fields on workers in Ontario Hydro. And this was done in conjunction with a similar study in Quebec and in France, a tri-utility study, which found increased risk of cancer as a result of high exposure to electrical and magnetic fields of people occupationally exposed. And then we did a study of childhood leukemia in Toronto, and we found increased risk of childhood leukemia. Those children who lived in homes where the wiring was such that they were exposed to high magnetic fields. And once I learned about the effects of radiofrequency radiation, at the time, the International Agency for Research on Cancer first reviewed this in 2011. I happened to be visiting scientist at the International Agency for Research on Cancer at that time. And one of my tasks was, in fact, to check the report, which was being produced, to make sure that what was being cited in that report was in fact correct in terms of the publications. And that introduced me to the publications up to that time. And I realized this was a major problem and that I should try and do my part to tell people about it and to try and reduce exposure. in Canada and elsewhere.
Mhm. That monograph is quite extensive.
Well, I've lived quite a long time, and I've been able to do quite a good. I've had many good opportunities, and I hope I've made good use of them.
Yes, and thank you. And the paper which you published in Environmental Research is entitled Cancer Epidemiology Update Following the 2011 International Agency for the Research on Cancer Evaluation of Radiofrequency Electromagnetic Fields, which is what you had reviewed. And in this paper, you go over the research studies published since that publication.
It's 2011, yes, that's right. That's exactly what we did. And we also, at the same time, communicated with the International Agency for Research on Cancer. We knew they were about to have a meeting of a committee to plan what they should be doing in the next few years. And recently we learned that that committee recommended to the director, the new director of IOC, that there should be a re-evaluation of radiofrequency radiation. Because in the 2011 evaluation, their conclusion was that radiofrequency radiation was a possible human carcinogen. In our opinion, my opinion, and the opinion of those who joined with me in writing this paper, which was published in Environmental Research, the evidence is now such that we would say there is certainty that this is a human carcinogen, which it would be called IOC Category 1. And if IOC were to do that, I think all governments would have to sit up and take action. So I'm hoping this will happen fairly soon.
Yes, and I know that that's been recommended. Do you know when the group, and I should say for everyone who's listening, because many people say, well, why hasn't the WHO, they would have changed the classification if it really was a problem, but actually there's this whole process that happens.
There's a process they have to go through. Not only IOC, which is the Cancer Research Agency of WHO, but WHO itself is going through a process now. And there are groups coming together to provide the evidence to WHO. I'm actually a member of one of these. And we're hoping that WHO as well as IOC will issue appropriate recommendations and that governments will take note of them.
Mm-hmm. Now, can I just mention one thing and have your thoughts? When you go to the World Health Organization EMF project, which is different than the International Agency for the Research on Cancer, there's a fact sheet that says that there is no established association between cell phone radiation and health effects. And people share this and say, wait, why, what, you're saying there's an issue, your scientists are saying this, what is that?
Well, WHO has been slow. I mean, they've got a lot of things to look at, but fortunately they have agreed to re-review this. That was an old statement that they should in fact withdraw. They haven't done that yet, but let's hope with what's going on currently and the groups that are going to provide evidence to them, they will in fact change their recommendations. We can only hope, but it would be criminal if they did not.
I'd like to ask you about another publication you did. And actually I co-authored along with several others the paper in Building an Environment about buildings and how to reduce radiofrequency radiation in buildings. And specifically, what are your thoughts about cell phones and wireless in schools, elementary schools, where they're being used all over these days?
Well, the one thing that in that publication and in many other statements we've made is that you have to remove wireless from schools. Children are particularly vulnerable. There is no excuse for exposing children to wireless. It's very easy to produce wired connections to the internet in schools. It can be done very easily, and that must be done. But it's extraordinary what happens. I mean, only a week ago, I sent a strong communication to a local council in an area fairly near where I live in Canada, where they were proposing to allow the introduction of a cell tower in the playground attached to the school. I mean, it's extraordinary how ignorant people are, and we have to do a great deal more to educate them. So I sent this extensive statement, at least not extensive because people don't read very much, but summarizing exactly what the issue was and explaining to them they had to prevent that happening. I haven't yet heard what will happen, but let's hope so. So this is the sort of thing all of us who know need to do all the time. And of course, Environmental Health Trust is doing that all the time, and I congratulate you for doing so.
Well, thank you. You've done so much, and I'm just honored to be talking to you today.
Well, I'm very pleased to talk to you, and thank you for giving me the opportunity.
So some people have sent me questions, of which I'm asking some of them. You can also put questions in the chat box or in the Q&A if you have them. And I wanted to ask a question that was sent about exposures to workers in hospitals and in healthcare, because people are writing that they're getting a CPAP, like the machines for breathing at night, which are wireless, as well as in the hospital, a lot of the medical appliances are actually wireless now. And there doesn't seem to be a choice for the workers, actually.
No, well, this is in fact an increasing issue. It sort of mirrors the ignorance of governments that people in hospitals of all places are exposing patients to radiofrequency radiation, and they have to stop it. They have to stop doing that. They have to provide wired connections, and it's very easy to do so. Hospitals are wired all over. So well, those of us who know have to continue telling them not to.
Mm-hmm. I know that there are, when it comes to ELF, extremely low frequency fields from the electric fields, that there are countries, because of the associations between cancer, leukemia, and magnetic fields, there are countries that actually have, either the authorities are recommending or de facto policy so that you can't build new builds of homes, and for some of these countries, hospitals, in areas where the magnetic fields, a type of electromagnetic fields, are high. And those are like Croatia, France, Netherlands, Italy, Denmark, Spain, Israel, Poland, Norway, and Switzerland. So here there can be reductions in ELF, but yet RF is being.
Yeah, no, well, it shows how uninformed people are. I won't use stronger language, and they need to be informed and need to do something about it. I'm at the moment involved in a suit in a city in Canada where the local provider of electricity is proposing to produce a transmission line going through the city close to people's homes. And there's a suit at the moment trying to prevent that because of the danger of particularly magnetic fields to people. So people are ignorant. Money is what drives them, profit. Health is ignored. We have to make sure that health and the protection of health is recognized.
So what gives you the hope and the energy to continue in this work in light of all the work that you've done over the decades? How do you continue?
Well, I think it's important that I should. I know quite a bit about the causation of cancer, and I think it's my obligation, while I'm able to contribute to people's knowledge, people's understanding, and try and prevent exposure just as much as I did years ago in terms of asbestos and so on. I'm privileged to have had opportunities to study causation of cancer, and although I no longer have an active research program, I can still write and communicate, and that's what I should continue to do as long as I'm able.
Thank you.
Thank you.
Does anyone else have any more questions that you want to ask in the chat? You can type that in. And here is a question that was sent to me. Actually, let me pull it up because I have a whole list here from people. Oh, this is about the most recent, I don't know, this is sort of breaking news, but after the French government did all of these tests showing that phones exceed regulatory limits at body contact, the Federal Health Agency of France, ANSES, recommended that phones be tested at body contact. And just on, I think it was Friday, the French, several French ministers now are saying, we recommend, based on that report, that phones be tested at body contact. And that is breaking. But what about all of these other devices like the Alexa, the virtual assistants that are in homes, wireless printers, wireless routers, all of these other devices which emit radiation, they also have fine print warnings. Should we also, how do we get governments to start looking at those as well as cell phones? Because I know when someone came over, actually my cousin was over my house and had a baby monitor, these wireless baby monitors, and one goes, you were talking about it, one goes with the baby, but the other one the parent carries around on their body.
I don't know. I mean, people have to be educated. When I bought a new computer about 2 years ago, I was given the option to have wireless connectivity of my mouse and my keyboard to my computer. And I declined that, and I have wired connectivity, as I have to my printer. So, I mean, there are ways we can avoid these sorts of exposure, and people need to understand how to do so. And if we can encourage people, we're talking to reduce their wireless exposure to as low as reasonably achievable, something we learned to do for X-rays many years ago, ionizing radiation, then we'll all be healthier.
Thank you. Yes, thank you. I have one more question, a few more thoughts from people who are writing in. You mentioned the recent publication by the NTP that just came out on DNA damage. And as I understand it, Lion Singh, a paper from decades ago, also showed DNA damage.
Yes.
Can you talk more about the importance of these findings in this $30 million study that found DNA damage. And that was in both the rats and the mice and tissues.
Yes. Well, I think it is important because we know that DNA damage precedes the occurrence of cancer. Cancer is caused by agents damaging DNA. And to be able to show that not only were cancers increased, but also DNA damage in other cells shows that we are, in fact, being exposed to something which can do an enormous amount of harm. And perhaps those animals didn't live long enough to get the cancers that would occur, but we live a long time. And if we're exposing ourselves to an agent which causes DNA damage, then who knows what will happen in the future. So it just adds to the evidence that we're dealing with something which is extremely hazardous to human health. And we have to reduce our exposure as much as possible.
Yes, thank you. Well, I'm going to conclude with a statement by a panel, a person who just wrote in to say that I recently got rid of my cell phone, and not only am I feeling my heartbeat anymore, but I'm also not sweating when I talk on my landline. Life is simpler, my stress level is lower, and I'm grateful despite the tragic nature of this technology. Thank you for the work you both are doing. And I thank you.
Thank you, that's nice. Thank you very much.
Thank you, Dr. Miller, for all of your work, decades on this issue of electromagnetic.
Did you know that cell phone, the one in your